Hello everyone. In this lecture, I am going to talk about the pathophysiology in preeclampsia. So, in the previous part of this video, I already told you that it is a two-stage disorder. And in stage 1 disorder, what happens? The problem begins in the placental area, right? And now these inflammatory mediators enters into the maternal systemic circulation and involving major organs in a woman and affecting these organs and causing various signs and symptoms, right? So in this video we'll discuss what all organs are affecting because of this pathogenesis of preeclampsia, that is vasospasm and the endothelial dysfunction, and what symptoms women may have with this preeclampsia. So in preeclampsia, the organ which is affecting most is the kidney. See, the basic pathogenesis behind all this preeclampsia is vasospasm and the endothelial dysfunction, right? But if you compare with the normal pregnancy, what happened? There is an increase in blood volume, and because of that there is a good amount of renal blood flow as well as good filtration rate as well, right? But here what happened? Because of this vasospasm, right? Because of this vasospasm, the afferent arterioles are not carrying that much of blood toward the glomeruli, right? So because of this vasospasm, there is a decreased blood flow, right? What is happening? There is a decreased renal blood flow, and as the flow is decreases, along with that there is a decreased glomerular filtration rate as well, right? And along with that, what is happening? There is endothelial dysfunction, and because of this dysfunction, the endothelial lining is damaging as well as they are swollen up. And because of this swollen up endothelial lining of glomeruli, here it is called as glomerular endotheliosis. So because of this, what is happening? The endothelial linings become swollen up, and because of this reason only the urine is not able to comes out or filter out, right? So the urine production is decreases in this condition, and that will lead into the oliguria, that is decreased urine production. It is about less than 400 ml in 24 hours urine collection, right? So why it is happening? Because the fenestras or the opening in the endothelial lining remain occluded because of this swelling in the endothelium, right? So urine is not able to come out, and as well the waste product, that is the uric acid. What all waste products are there which comes out with this urine? The uric acid as well as the urea and the creatinine also not come out with this urine. So if they are not able to come out with this urine, then what happened? The serum level of these waste products remain high, right? So what all clinical features women may have with preeclampsia? The woman may have oliguria, that is the urine is not producing well because the endothelial lining is damaging, they are swollen up, and there is a vasospasm. Because of this, the flow is reduced, the filtration is also reduced, as well as the urine is not able to comes out, right? Now this was about the kidney. Then what happened with the liver when this vasospasm and endothelial dysfunction takes place? So in the liver, because of thrombosis in the arterioles, what happened? There is a periportal hemorrhagic necrosis. Periportal hemorrhagic necrosis is there. Why it is happening? Because of this vasospasm and the endothelial dysfunction that causes thrombosis in the arterioles, and that will lead into the periportal hemorrhagic necrosis. And because the parenchymal tissues are now damaging, so the liver enzymes are elevating. So what all liver enzymes are there? The AST as well as the ALT levels are increasing. aspartate transaminase and alanine transaminase, and these are also known as SGOT and SGPT. So serum glutamic oxaloacetic transaminase and serum glutamic pyruvic transaminase, the level of these liver enzymes is also increasing because of this necrosis, right? And if this periportal hemorrhagic necrosis is exceeding, and that will causing the bleeding beneath the subcapsular lining, that the blood is collecting between the capsule of the liver as well as the parenchymal tissues of the liver, that will causes the subcapsular hematoma. So because of this bleeding which is accumulating beneath this capsule and the parenchymal tissues, that may cause a stretching of the capsule and causes pain in a woman. So the pain is in the epigastric region, or you can say the right upper quadrant pain or the right hypochondriac pain, because it is situated in the right hypochondriac region. So because of the stretching of the capsule, the woman may have epigastric pain as well as the right hypochondriac pain, and that indicative of that the liver are also involving and the woman is having severe preeclampsia. Now what all changes will take place in the placenta by this vasospasm and the endothelial dysfunction? See, the problem begin in the placenta only, and we know that there is a vasospasm in the spiral arterioles. So the maternal blood is not going well toward the placental side, and because of this vasospasm, so placenta is not able to extract oxygen as well as nutrient from this blood for the fetus as well as for their tissues itself. So because of that, what happens, the placenta gets separated slowly, and there is a feature of early separation of placenta because the tissues are not receiving that much of nutrient and they are necrosed or they are ischemic. So because of that, what happens, the placenta get separated and there is a feature of abruptio placenta. So because of this vasospasm and endothelial dysfunction, what will happen, there may be a feature of abruptio placenta, that is the early separation of placenta, and along with that the woman may have oligohydramnios, and because of this oligohydramnios, because the amniotic fluid volume is not that much, that is decrease amniotic fluid, the fetus is also not able to extract their nourishment, so the fetus will have intrauterine growth retardation, right? So with this dysfunction, the fetus may retarded and there may be a chance of early separation of placenta. Now with this pathogenesis, if the cardiovascular as well as the lungs are involving, then what happened? So in this, because of this vasospasm, what happened, the peripheral vascular resistance is also increasing, and that may lead into the increased blood pressure in a woman. And once the endothelial dysfunction occurs, then what happened, the capillaries become more leaky, and with this leakage, the intravascular plasma, right, the intravascular plasma is now leaking toward the interstitial spaces and start collecting inside these cells. So with this damaging endothelial lining and the leaky capillaries, what happened, the plasma leaks out and start collecting inside the interstitial spaces, and that may lead into the edema, right? So women may have edema. Physiological edema is quite common with this normal pregnancy, and it is limited up to the ankle region only, and that can subside with the rest only. But here these pathological edema can extend up to the legs, as well as it can involve the abdominal wall, it can involve the face as well. So with this pathological edema, the woman may have weight gain. So if the woman is getting more than 5 pound in a month, or if she is having more than 1 pound in each week, then we can call it as very dangerous for a woman. So as the fluid is shifting to interstitial spaces, what happen? The RBCs count in the blood is increasing. So there is a hemo concentration. So there is a hemo concentration and there is an increase in hematocrit level. So as the level of RBCs are rising in these women, they are more sensitive to blood loss, because the woman with a normal pregnancy in a state of hemodilution, right? So if the blood loss occur in these women, then they can easily tolerate because the plasma is also losing. But here what happens? Plasma is already shifting toward the interstitial spaces, right? So once the blood loss occurs, the more RBCs will be lost, and there will be a chance that the woman may have shock, right? So they are more sensitized to blood loss. So after this rise in RBC, what happens with the platelet? Because we already know that there is an endothelial dysfunction. So once the lining become damages, now the role of platelet become high and they are consuming and they are used up there, right? Because they need to form clot because of this damage, right? So platelets are used up, so that's why the free circulating platelets count is decreasing. So because of decrease in platelet count in blood, there is a thrombocytopenia, right? So platelet count is also decreasing. So if we talk about the lungs, then again there is a leaky capillaries and these fluid is shifting toward the interstitial spaces, and that causes the fluid around the lungs, and that may lead into the pulmonary edema. So women with this edema may have breathlessness, right? So she may have difficulty in breathing because of this fluid collection. Now what happened when the CNS is involving, that is the central nervous system is involving? See, before that, what normally happens? There is a cerebral autoregulatory mechanism that help in maintaining the constant level of cerebral blood flow, right? So if whether there is increase in blood pressure or whether there is a drop in blood pressure, the blood flow remain constant because of this autoregulatory mechanism. But here with this pathogenesis, because of vasospasm and the endothelial dysfunction and because of the increase in mean arterial pressure, this autoregulatory mechanism disrupted, right? So with this disruption, there is a hyperperfusion, and with this hyperperfusion and along with this endothelial damage, what happened? Again there is a leaky capillaries. So with this leaky capillaries, what happened? The intravascular fluid is now shifting toward the interstitial spaces. Okay. So because the fluid is shifting, that may cause the vasogenic edema. So depending on how much the area is involving, that brings about changes in women that may cause headache as well as visual disturbances. Headache as visual disturbances in a woman. So mainly it is involving the occipital lobe as well as the parietal lobe, and once the occipital region is involving, because we are knowing that this region is responsible for the vision. So once the occipital region is involving and there is a vasogenic edema there, then it can cause the visual disturbances in women, like that may cause blurring of vision as well as this can cause scotomata or scotoma, that is the partial loss of field of vision, right? And that may even cause diplopia, that is the double vision, right? But blindness is very rare. It does not happen oftenly, but it is happens so severely that it involves many of the region and it excites many of the neurotransmitters with this edema, especially the glutamate, then it can cause convulsion in a woman. So this preeclampsia can be complicated with the convulsion if the edema is so severe, and that may ultimately change into the eclampsia, right? But along with that, if the vasospasm takes place in the retinal vessels, that can also cause the retinal detachment. So there are many manifestations that indicate that the CNS is involving, right? So the basic are the headache as well as the visual disturbances, right? So in this lecture we have seen with this vasospasm and the endothelial dysfunction how these organs are involving and what all changes these brings about. Thank you.